Welcome to the Weiser Center for Prostate Cancer, a sanctuary for hope where you and your family can thrive, from diagnosis through treatment, with patient-centered care from our team of experts and the wisdom of advocates and former patients.
Fusion biopsy is a diagnostic test that's performed for prostate cancer. So men that have a clinical suspicion of having prostate cancer, either because they have an abnormal rectal exam or they have an abnormal blood test that indicates that they may have prostate cancer, or they have some other biomarker test done, will undergo fusion biopsy. These men will have a MRI completed before the biopsy, and then they come in and we take the MRI and we fuse it with an ultrasound in order to take targeted samples in regions of their prostate that have the highest chance of finding prostate cancer. These samples are taken in addition to standard samples that are taken around the rest of the prostate as well too. Fusion biopsy helps us diagnose prostate cancer with more precision. Fusion biopsy is useful for diagnosing prostate cancer. Typically, when we perform a prostate biopsy, we're taking 12 samples of the prostate, looking underneath the microscope and looking to see whether there's prostate cancer there. When a fusion biopsy is performed, a man's having an MRI completed beforehand, and the radiologist is marking areas in the prostate that have the highest probability of finding prostate cancer. And then we fuse the images from the MRI with images that are taken during the prostate biopsy with the ultrasound in order to target those areas. By doing so, we get higher precision for diagnosis of prostate cancer and prevents us from missing potentially clinically significant prostate cancers. Most of these prostate biopsies occur in the clinic. About 90% of our prostate biopsies are performed under local anesthesia in the clinic setting. Patients come in and they're usually either laying on their side or laying with their legs up, depending on the type of biopsy that's being performed. The procedure itself takes about 20 minutes to perform. The last 15 minutes, there's usually not much discomfort. One patient described it like having a rubber band around your wrist, and every time we take a sample, it's like pulling back on the rubber band and you feel that sting. The first 5 minutes can be uncomfortable. That's when the doctor is usually numbing up the prostate and the area around the prostate in order to take the biopsy. During the biopsy procedure, the urologist is going to take the MRI images, fuse them with the ultrasound images, and then take samples of the targeted region as well as regions around the rest of the prostate too. Fusion biopsy is very beneficial for patients because it allows us to detect prostate cancer with greater precision, and it keeps us from missing clinically significant prostate cancers that might be missed on a standard biopsy. Fusion biopsies nowadays are very safe. We take a lot of precautions to prevent infections that may occur during the biopsy, and we do techniques to help eliminate as much discomfort as possible. With that said, there are some risks to getting a prostate biopsy done. Usually men will have blood in the urine, semen, and stool for up to 2 weeks after the procedure, and then there is also a risk of an infection as well. To prevent that, we usually will give the patient antibiotics prior to the procedure and also take a number of different steps to help prevent those infections. So both the transrectal fusion biopsy and the transperineal biopsy are good ways to diagnose prostate cancer. At University of Michigan, we do perform a lot of transperineal biopsy, and the reason that we do the transperineal technique is because it reduces the risk of infection. Every prostate biopsy, no matter how much you try to prevent an infection, can be associated with a small risk of infection. Sometimes those infections can be very serious and you have to be hospitalized as a result of that infection. A lot of the evidence, both from our institution and from elsewhere, has shown that the transperineal biopsy has a significantly lower risk of infection compared to transrectal biopsy. That's one of the reasons that we started adopting it about 5 years ago and use it for many of our patients.